There is no easy way to say this. Your evening libation may come with some hazards you aren't aware of. That's probably the last thing anyone wants to hear in what feels like month 1000 of a pandemic, where a nip at the end of a long day may be a source of some comfort or even fun. But as the Canadian Cancer Society's current Dry Feb initiative highlights, drinking alcohol can apparently add to your risk level for cancer, among other dangers. With us to explain, we welcome in Victoria, British Columbia, Tim Stockwell. He's a scientist at the Canadian Institute for Substance Use Research and a professor in the Department of Psychology at the University of Victoria. Back here in the province of Ontario, in the beaches of the provincial capital, Erin Hobin, scientist at Public Health Ontario, with appointments at the U of T's Dalla School of Public Health and the Canadian Institute for Substance Use Research. And in Lawrence Park, just north of our Midtown studio, there's Dr. Leslie Buckley, Chief of Addictions at CAMH, the Centre for Addiction and Mental Health. And we're really glad to have all of you three on our program this evening. I want to set up our discussion, if I can, by just reading this. Sheldon, if you would, let's bring up the graphic and I'll go through it here. The sobering news is that drinking any amount of alcohol increases cancer risk. Alcohol increases your risk of head and neck, breast, stomach, pancreatic, colorectal, and liver cancers. If more Canadians limit their alcohol intake, we could prevent about 44,300 cancer cases by the year 2042. Erin Hobin, why don't you get us started here? What is the definitive link between alcohol and cancer?
The World Health Organization's International Agency for Research on Cancer classified alcohol as a Group 1 carcinogen, the highest level of risk in 1988. And as you just showed in your graphic there, alcohol has been confirmed to increase the risk of at least 7 types of cancers, so cancers of the digestive tract as well as female breast. And there are multiple pathways by which alcohol can increase your risk for different types of cancers depending on the organ affected. But generally, the ethanol in alcohol is metabolized in the body into acetaldehyde, which then binds with and damages the body's DNA and proteins.
And Erin, let me do a follow-up with you. You know, sometimes we hear about these things and then it comes out in the fine print afterwards that you'd have to drink 25 bottles of wine a day for it, in fact, to be carcinogenic. Most people don't do that. In fact, I don't know anybody who does that. So what intake are we talking for this to be problematic?
So definitely the more alcohol you drink, the higher your risk. However, the most recent evidence is suggesting that even light and moderate amounts of alcohol can increase your risk of cancer by small amounts. And it is also important to note that all types of alcoholic beverages, whether it's beer, wine, spirits, coolers, or hard liquor, contain ethanol, which can increase your risk for cancer.
Tim Stockwell, what groups would you say are most at risk for alcohol-related cancer?
It doesn't really spare any of us. I mean, clearly for breast cancer, women are the main risk. In fact, 1 or 2 men get breast cancer. One of the cancers that's not mentioned in the standard list is prostate cancer, and there's increasing evidence that starting from a low dose, the risk of prostate cancer for men increases. So it's basically all of us, and in later years, because these risks tend to take a while to accumulate, we have to expose our body multiple times over the years. Usually, I mean, it's a lottery. It's just your chance of getting an alcohol-related cancer increase as you get older.
Well, speaking of lottery, would genetics therefore play a role in any of this?
I believe so. I mean, we're all genetically predisposed to different diseases, and cancer's no exception.
Okay, Dr. Leslie, how about stress? What role would stress play in any of this?
So one thing we know about stress and drinking is that they're linked. So we can see, you know, in the neurochemistry that when stress levels increase, we can see centers that we know are responsible for craving lighting up. So we know that, you know, even from a biological level, stress is an important factor. And certainly I think that everyone is experiencing in the pandemic, we're seeing increased alcohol use, and we know that stress is the leading factor for that.
Erin, what about the notion that we used to hear in the past, which was that 1 glass of wine over dinner, never mind wouldn't hurt you, but actually had some medicinal value to it?
That's a very good question, and that often comes up because that is a common belief among the general public. But there is very convincing evidence that has been published recently that challenges that belief and actually shows that any type of alcohol, whether it's red wine, can indeed increase all alcohol-related health harms, including cancer.
So the new recommendation is not even a glass of wine over dinner?
So in Canada, we have the National Low Risk Drinking Guidelines, which provides daily and weekly limits for both men and women. So under these guidelines, women are advised to drink no more than 2 drinks per day or 10 drinks per week. And men are advised to drink no more than 3 drinks per day or 15 drinks per week.
Okay, we're going to follow up on this some more, but first we've got a little excerpt from the Globe and Mail here that we want to read in the meantime. So Sheldon, if you would, let's bring this up, and here we go. A report by the Canadian Centre on Substance Use and Addiction estimated that nearly a third of Canadian drinkers already consume more than the current weekly recommendations. Even by international standards, Canada falls on the boozy side. According to the World Health Organization, Canadians drink 8.9 liters of pure alcohol, that's about 9 bags of milk worth, per capita each year. That's well above the global average of 6.2 liters. Once again, we're at 8.9 and 6.2 is the recommendation. Tim Stockwell, how concerned are you about those numbers?
I'm very familiar with these numbers, and in fact, they underestimate the extent to which, unfortunately, Canadians don't comply with the guidelines. The problem is that when we measure how much people drink, and they self-report in surveys, and you count up all the drinks that they report, it's about a third of the alcohol known to be sold. So the problem we're having here is that these are underestimates from self-report. In fact, when we've crunched the numbers, taking account of underreporting, roughly 75% of all the alcohol consumed in Canada is drunk in a way that is outside of those guidelines.
All right. Well, Leslie, let me follow up with you on this. The guidelines that have been in place for a decade, and again, that's sort of 2 drinks a day on average for a woman, 3 drinks a day on average for a man. Do you think those numbers are out of date today?
I think it's so hard to determine the right numbers because you're balancing the risk of, the cancer and other harms that can happen with alcohol with the relevance. So, if we were really just thinking of risk, we would say 0. And if we were, we're balancing that with relevance. And when you compare us to other countries, we are high with our numbers. So it's very likely that we will probably change and begin to match some of the other countries who have lower guidelines than us right now.
And I don't know if you've got hard stats on this, because after all, it's less than a year, but is it your impression anyway, or do you have stories from patients about whether or not we're drinking more during the pandemic?
Multiple, different studies have shown that we are drinking more during the pandemic, and alcohol sales are up as well. So we're recognizing that there's been an escalation, yes.
Tim, I saw you nodding your head at that as well. You've got it categorically confirmed we are drinking more these days.
Yeah, I've been looking at the sales data as well as self-report data, but the sales clearly show, particularly during the first lockdown, the data show here in BC about a 7% increase, and we found consistent increases in most provinces. And stress is part of it, but it's also the convenience of access. For the first time, alcohol is now delivered to our doorsteps in many parts of Canada.
And let's follow up with this. I mean, binge drinking, obviously binge drinking is not a great idea, but do you want to go into some more detail about why it's so harmful to you?
Well, there's multiple aspects to that. Clearly the risks from alcohol are about safety as well, risks of accidents and injuries, but it's also the assault on our bodies. So the kind of risks, the mechanisms that Erin was describing about how alcohol can cause cancer, if you get a series of acute assaults on your digestive system, for example, the body has to work harder to heal itself, and the risk of it failing to replicate itself, our body is regenerating all the time. And if you're daily assaulting it in a sort of binge style, high blood alcohol concentration, the body has to work harder and there's greater risks of it failing to replicate itself and tumors developing.
Erin, I think the police do a pretty good job at keeping the statistics on alcohol-related tragedies on our roads. We probably have a pretty good understanding of alcohol-caused deaths on the roads. But I wonder whether the medical community keeps those kinds of statistics for alcohol-related deaths in hospitals, for example.
Tim Stockwell's group actually published a fascinating paper in 2020 on this exact topic. So maybe he could speak to some of the results published in his paper.
Sure, Tim, go ahead.
We do have a study. It's called the Canadian Substance Use Costs and Harm Study. We monitor it. We can find all the data on a website. The total number of deaths each year related to alcohol that would not have occurred without alcohol consumption, we estimate to be at least 18,000. And that was in the last year we looked at this. It may be up to 19 or 20,000 now. Of those, about a quarter would be cancer related. Maybe 7,000 or 8,000 would be related to some kind of injury or accident.
All right, we are in February, and the Canadian Cancer Society has decided in its wisdom that it has come up with a new idea for getting people to drink less, and that is this notion of dry Feb, dry Februaries. Don't drink alcohol in February. That's what they're suggesting. And we're going to roll just a little bit of their public service announcement to that end. Sheldon, if you would.
Well, it's certainly been an interesting year. And like many of us, maybe you've been drinking more than usual and want to take a break. With Dry Feb, you can.
Why not challenge yourself to go dry in February to help raise funds for the Canadian Cancer Society?
Sign up for Dry Feb, and not only will you be helping people affected by cancer,
you can also reduce your risk of cancer.
Go as dry as you're willing to try this February. Sign up today. It's easier than you think.
Well, Leslie Buckley, admittedly, we're not that far into February yet, but any sense about whether this is working?
I think it's having an impact in a few ways. One is in the media. So people are picking up on the issue of alcohol. It sort of highlights the issue and gets us thinking a little bit about it as a society, but also as individuals. And it's a sort of an invitation to set a goal. What's unique about Dry Feb compared to what happens in some other countries and Dry Jan is that usually it's an absolute dryness, but this one allows for your own goal. And what will be interesting will be to see if it sticks.
Erin, any sense in your community or in your world about whether or not these kinds of campaigns are useful?
I think this approach is very interesting. Some of our work has shown that about 25% of Canadian adults who drink alcohol actually know that consuming alcohol increases their risk for cancer. And this low public awareness in Canada is consistent internationally in the evidence. So I'm very hopeful that campaigns such as the one that the Canadian Cancer Society is running will increase the public awareness of the link between alcohol and cancer.
Tim Stockwell, your view on the campaign?
There's been good work done on this in other countries, and people report fantastic benefits, even if they're just moderate drinkers. The tendency is for people who complete the month to say they sleep better, they experience less stress, they're taking more exercise, they're saving money. And interestingly, it's not just a one-off. There tends to be a consistent, long-lasting effect where they drink a little bit less in the following months and years, which reduces their risks of diseases.
Tim, you talk about saving money. Let me just do a quick follow-up on that, because, of course, I don't know if a study has ever been done on the money saved in terms of healthcare down the road versus the money that the Treasury loses in the short run, because people are not, in Ontario, for example, going to the Liquor Control Board of Ontario or the beer store to buy. Do we have any idea about how that works itself out?
Yes, we do, actually. In fact, with a colleague, we published stats on that last year for each jurisdiction. On average, across the whole of Canada, the costs exceed the revenue taken. So the revenue covers about 75% of the costs of healthcare, police, and lost productivity. And in Ontario's no exception, and there's no single jurisdiction in Canada that doesn't have an alcohol deficit.
So just so I'm super clear on this, because we hear this all the time around budget time. We hear that it's good that people imbibe because that money goes into the Treasury to pay for roads and schools and hospitals and so on and so forth. But you're saying that if everybody stopped drinking tomorrow, we'd actually be ahead when it comes to money.
Absolutely. There'd be a bit of a shock to the whole, the structure of our economy, because alcohol is tied up with a lot of things. But just strictly the bottom line, we'd be ahead. A lot more would be saved than would be lost from, the costs of running hospitals and making the roads safe, and there'd be less pressure on the criminal justice system, more productivity. That would be way ahead than the revenue that we'd lose.
All right, Erin, pick up the story from there, because, on the one hand, we've got this public service announcement from the Cancer Society, and that's all well and good, but it is competing against billions upon billions of dollars in advertisements, in sponsoring events, in all kinds of things that obviously encourage us to drink more. So how do you like its chances?
Alcohol advertising in this country is pervasive. Anyone who's watched Hockey Night in Canada can attest to that. And the evidence shows that alcohol advertising influences societal norms as well as beliefs and perceptions about alcohol, particularly among adolescents and young adults. And as you said, reports show that the alcohol industry spends billions of dollars every year on advertising, and this spend is now largely spent on new media, so celebrity endorsements, event and sports sponsorship, as well as social and online media. And the intent of this type of advertising is to interact and develop positive relationships with current and future consumers. Just to underscore the important role that alcohol advertising plays in driving alcohol use, the World Health Organization has identified 3 most cost-effective policies for reducing alcohol use and related harms. And one of those 3 is to ban or comprehensively restrict alcohol advertising.
Okay, ban and restrict advertising. Let me go even further. I well remember the time in this province when you couldn't buy a beer at a baseball game. Today we have a different problem. You can't go to a baseball game at all. But let's assume that when baseball comes back, Labatt's used to own the Blue Jays, for example. I mean, a brewery owned the baseball team. Can you imagine anybody turning the clock back and saying, no more beer sales at ball games, no more beer sales at hockey games? Is that reasonable?
I mean, in Canada, alcohol is such a part of our culture, our daily fabric. It's completely normalized in our everyday lives. So I think it would be very difficult to do something that extreme, where we're not allowing alcohol at entertainment, at our events. One potential sort of first step is to more broadly promote Canada's low-risk drinking guidelines, to promote consuming alcohol in moderation or safer levels of risk.
Well, that's an interesting approach. So, Leslie Buckley, in terms of your recommendations, for example, as a medical doctor, would you say better to just arm your patients and the broader population with the knowledge that if they drink too much, they could be encouraging cancer, or better to have governments come in and legislate an end to, for example, alcohol sales at baseball stadiums?
The most effective option is the latter. So we know that the most powerful lever is accessibility, and that includes locations you can purchase alcohol, hours you can purchase alcohol, and price. So as much as the other factors may be helpful as well in terms of trying to reduce and improving education, we know that really in the end, nothing competes with those levers.
Okay, Tim Stockwell, let me get you to follow up. A prohibition on alcohol sales at all sporting events in the country. What politician is going to go to the electorate with that?
They won't. At this stage, I think we need both education and regulatory approaches. We need labels on alcohol containers warning of cancer risk and promoting guidelines in order to make people realize this matters. We can't just suddenly impose heavy restrictions on what people are used to doing without them understanding the reason. So all of the effect, we need minimum prices to be increased. That's the most effective thing that could be done. We need to look at convenience of access, but we need to give people the reason for why we're doing this, because like 75% of them are not aware alcohol is a carcinogen. So we have to work hard on both fronts.
I shouldn't admit to this, but Tim, I do remember the days, for example, at Iverwin Stadium in Hamilton, going to a Ticats game when sales were prohibited. I mean, there was no alcohol sales. People snuck it in. People snuck Mickeys in. People want to drink. I mean, is this really, is it even possible to legislate this out of existence?
Well, look, there are intermediate strategies, and I've seen them work. I used to follow cricket. Probably a lot of people watching have no idea what that sport is or what the rules are. But when I lived in Australia, you could only buy a limited amount of beer, and you could only buy it in a plastic, have it served in a plastic glass, so there would be fewer glass-related injuries. There wouldn't be broken glass. People wouldn't be using them as weapons. And you can restrict the number of drinks people can buy. So there are intermediate strategies that work.
Leslie, let me follow up on the labeling issue, because we know that over the course of time, the labels, for example, on cigarettes, the Surgeon General's warnings, those pictures have become increasingly gruesome over the years, and I guess the thinking is that they have encouraged some people not to smoke. Do you think we need those kinds of stark labels on alcohol?
I think that we should look to smoking cessation, in terms of models that will work, because it was incredibly effective. And, if we can transfer that effectiveness to alcohol, we'd have to study it again, because we can't assume that it would work in the same way with the gruesome photos. But, to start with labels, that clearly identify the risks. Think about something like you just suggested with a stronger visual, getting rid of all marketing on alcohol. I think we would be moving ourselves ahead.
Erin, what's your view on increasingly stark labeling on alcohol?
So actually, Tim and I collaborated with the governments in Yukon and Northwest Territories to experimentally test large, bright yellow alcohol labels with 3 rotating messages: a cancer warning, Canada's low-risk drinking guidelines, and the number of standard drinks in an alcohol container. And these labels were applied to all alcohol containers sold in the liquor store in Whitehorse. And after the 8-month intervention period, our results showed that consumers in our intervention site had higher odds of knowing the link between alcohol and cancer and Canada's low-risk drinking guidelines. And compared to our comparison site that wasn't exposed to the labels, and using official government sales data, we observed that alcohol sales in our intervention site were reduced by 6% relative to 2 separate control sites without the labels. So the results overwhelmingly show that well-designed alcohol labels can support consumers in making more informed and safer alcohol choices, similar to the effectiveness of tobacco labels.
Tim, again, I see you nodding. You're in favor of tougher labeling on ad and that type of thing?
Well, some labeling. I think the absence of it signals this doesn't matter. I mean, I think people must think subconsciously, well, the government would warn me if this was a serious health risk. And alcohol gets a free ride on so many levels. Producers don't have to say how many calories are in alcohol, which is outrageous. So here is a grade 1 carcinogen and we're not warned about it. The government is in the business of selling it and distributing it for sale. And the least it could do is to inform its citizens of the risks of that. And they could actually be exposed to litigation. There could be civil lawsuits, like there have been with alcohol against the tobacco manufacturers. But for the failure, there's a duty of care to warn citizens, and they have a right to know.
I'm sure there are people watching this and listening to it on podcast who will remember, and you probably got to go back, gosh, I don't know, is it 30 years ago? Maybe it's more, when cigarette advertising was legal and cigarette companies could sponsor sporting events and tennis championships and auto racing and that kind of thing. And then it all got banned. And I wonder whether or not you think, and I'll get the 3 of you on this, whether you think that step is necessary for alcohol? Do we need to ban advertising? Do we need to ban the sponsorship of public events? Dr. Buckley, you go first on that.
I would agree with the ban. I do have a distant memory of those days. And, to pick up on Tim's point about the subconscious plays a big role in terms of, decision-making around alcohol, because we know that someone's perception of the harm of a substance really will factor in on how much they consume. So if society is allowing advertising and it seems just great, that's going to creep into our subconscious and affect our behavior.
Erin, I do remember at the time people were saying, you know what, this is going to be the end of sports. This will be the end of auto racing. This will be the end of tennis. If you take away this kind of sponsorship money, they'll all fail. They didn't fail, obviously. But is it appropriate to ban the advertising of what is essentially, at the end of the day, a legally sold product in the country?
Well, I mean, sticking with the evidence, it is well established that alcohol advertising and marketing increases per capita alcohol use and harm. So if that is our priority to reduce consumption and harms, then I think we do have to consider a ban or at least some restrictions or stronger restrictions on alcohol advertising.
Tim, how about you? Advertising and sponsorship, where are you on that?
I'm in agreement. I think probably all of the listeners would, if you ask them, does advertising affect you? Most people say no. I'm not affected by advertising. It's this subconscious effect. And there's been studies showing that 5-year-old children, if you show them an image of their favorite sporting events and blanked out advertising billboards, they can fill them in and draw pictures of whether it's cigarette cartons or beer containers, whatever the issue is. So the subconscious effect on our, desire to consume alcohol starts at a very early age. And it wouldn't be a multi-billion-dollar industry if it didn't work. So yeah, it's very effective at increasing our consumption and our risk of cancer as a result.
I'm going to ask Erin and Leslie a very mischievous question here because, you two are sort of public servants and are paid by the government of Ontario. And therefore, I want to ask you whether you think the government of Ontario's efforts to liberalize the sale of alcohol during this pandemic, curbside delivery and so on and so forth, what you think the impact of that has been. Erin, you first.
Well, the evidence, the work that Tim is doing and some work that our team is doing has shown that alcohol sales have increased by about 7% in Canada during the pandemic. And there is very strong evidence showing that increasing the physical availability of alcohol is associated with increased sales and use.
Leslie Buckley, your view?
So, I think it's complicated with government because they're often responding to the public or what they believe the public thinks. This trend has been going on, even prior to this government. So it's not new. It's concerning to everybody who's, working in our field. And maybe a strategy is to educate the public more so that they will, be more knowledgeable and maybe support different policies that the governments might consider.
In which case, if you are having this conversation with your patients, how do you advise them on, if they can't go cold turkey all at once, how do you advise them to drink less?
Well, that's a great question. It's, something to think about is just whether it's safe. So depending on how much you're drinking a lot for many years, you should connect with your family doctor before you try to stop or slow down. If you want to just slow down, then, best approach is the numbers. Numbers don't lie, and it's a great way to, even just counting helps people reduce. You can alternate your drinks. So if you have one drink that has alcohol in it, your next drink is a soda or soda water. It just gives you time until your next drink, and the idea being that you would consume less over the night. So those are a couple of tips that a lot of people find useful.
Erin, if you're a moderate drinker, is it a good idea to just go cold turkey and stop drinking and embrace this Dry Feb campaign?
Yeah, I mean, I echo what Dr. Buckley just discussed. Canada's low-risk drinking guidelines also provide some very similar and useful tips for people who are looking to cut down on their drinking.
Now, I gather, Tim, we're going to see new guidelines from the federal government and the provinces. When is it? Next year, I guess. And I mean, on the chance somebody's watching right now, what advice would you like to give them about where you'd like to see the guidelines go?
I'm actually on the panel that's, as is Erin, working out what the current state of knowledge is and what the best advice is. And I think the cautious thing to say now is to drink within the present guidelines, definitely not above them. They're likely to go down because we know more about the cancer risk, and we have stronger reasons to doubt that there are any health benefits. The previous guidelines balanced one against the other and said if you drink within these levels, the risk of harm is balanced by your likelihood of getting benefit. Well, there may not be any benefit, and the risk seems to be worse than we previously realized. So the more you drink, less is good is probably the right answer.
We often say that in journalism, less is more. Okay, we're less than 2 minutes to go here, and Erin, let me put this to you. You know, I imagine there have been people who been watching us for the last half an hour and say, look, you got to die of something. And, if the average age life expectancy for a man these days is, I don't know what it is, 81 or 82 or 3 or something like that now? And so if I end up dying at 78, 79 or 80 instead of 81, 2 or 3, but I get to have a few nips along the way, that's a price I'm content to pay. What would you say to that person?
Yeah, I mean, people enjoy drinking. Talking about the risks associated with drinking is not a popular topic at a dinner party. I think what I would tell people is that Canada has the low-risk drinking guidelines, which provide limits for safer alcohol consumption, and drinking within those guidelines will support in lowering your risk for any types of alcohol-related harms.
Tim, last word to you. What's the point of living to 85 if you can never have a scotch and soda?
Well, no one's saying you could never have one, but I'd love to know how many Canadians would say they wouldn't even give up 6 months of their lifespan. Or would they be prepared to give up 5 or 10 years? On average, exceeding the guidelines will knock 4 or 5 years off your lifespan if you do that consistently. I'd love to know whether that matters to people. So I think people should have the choice.
You have all educated us terrifically tonight here on TVO. Thanks to Tim Stockwell, Erin Hobin, and Dr. Leslie Buckley. Stay safe out there, everybody. And, I assume, can I see a show of hands? Who's doing Dry Feb? None of you.
Sorry.
Oh, that's hilarious. Okay. Well, thank you anyway for showing up on TVO tonight. Appreciate it very much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.